Hi. As Gillian said, I am the director of the DHS, the Demographic and Health Surveys. And it is indeed a great honor to be here. It's not a forum that I am familiar with. It's not an area that the DHS has tended to focus on. But I do want to take this opportunity to inform and those of you who are not familiar with the DHS as to what it can and what it cannot do for this. As our earlier speaker said, as parents, we are all involved. As researchers, we are dealing with people all of the time who, like us, have gone through an early childhood that has allowed us to either prosper or not prosper. And we at the DHS are, in fact, dealing with both mothers and children, but not necessarily of the age group that you might be wanting to focus on. Nonetheless, let me sort of show you what I'm arguing about. Many of you are familiar with the DHS, but just in case you aren't, it is a USAID-funded project which has been in existence since 1984. It's a survey-based, face-to-face survey-based project that collects data, and its objectives have always been to improve the collection, analysis, and presentation of population health and nutrition data. And that's very, very key and distinguishes us from a lot of other survey programs. Its main objective is not just to collect the data, but to facilitate its use. This is a map of the world telling you the countries in which you would find DHS data. And we've obviously, since we've been in existence for 30 years, this year it'll be the 30th year since data collection started. There are hundreds of surveys, and many, many countries have had several surveys. So you get trend data. Okay, very quickly, this is not the main part. This is not the sort of thing you might be fully interested in, but there are household questionnaires and women's questionnaires and men's questionnaires. And in every country, that's how we collect the data. Women are asked about themselves and about their children, their births. And we get information on children under 5 from the mothers, and also on children, on all children in households. Next, please. It's a very important program because, in fact, this whole search for metrics, for nationally informed programs, has to come in part from something that speaks to policymakers. What's happening at the national level for the country as a whole, because that's who they answer to. And that's why the DHS perhaps is very important. For most countries, for the countries in which we work, the DHS has often been considered the gold standard for providing a lot of the data that policymakers need. And it's nationally representative, typically. It's based on all women in the households who are between the ages of 15 and 49, and men age 15 and old, 54 or 59. As I said, we collect information on children in the household. So we have education for children in the household, all children starting from the age of 5, or not in most countries, the early childhood education, so below 5. We have information on birth registration. We have information on orphanhood for all children. But from mothers, we find out the health of these children. We also, by the way, have information on stunting and malnutrition status, anemia status of all children under 5 in the household, whether their mother was interviewed or not. Internationally, it provides internationally comparable indicators. So if you're talking about, one thing about the DHS is that it is standardized, the way we present the data, the way the data are available for researchers to analyze, it is all standardized. So if you've got a variable V133, it will be education no matter which country you're looking at for data. All methods are standardized across countries on how we collect these data, so it gives you a comparable picture. These are freely accessible, freely available data sets downloadable from the website. Open data policies are followed. Assistance, and for countries, there's a lot of local implementation assistance and use assistance. Okay, next, please. As I mentioned, the two key things that we get for children, we have a lot of biomarkers in the DHS, but the two key things that we do have for children are height and weight, which allows us to measure the malnutrition status, or obesity, which is becoming an increasing issue in the world, even among children. So these data allow us to look at it in both ways. And of course, anemia information, which has become very important also for malaria. And there are a whole lot of other. We do not normally, not that it's not been done in some countries, test children, infants for HIV status. We go for the mother, testing the HIV status of the mother. Okay, very specifically, what are the data that you do have for children? You have birth registration. You have orphanhood status for children under 18, sometimes under 15. Marriage, of course, early marriage. Percentage of children that are born with low birth weight. There's childhood vaccination coverage. All of the stuff that you've probably heard of already from the mix, because we do harmonize with the mix. Prevalence of diarrhea, ORT, etc. All the stuff that tells you whether children are healthy or not. And prevalence and treatment of fever and symptoms of ARI among children under 5. So a lot of the stuff we get from mothers will be only for their births that were under 5. And I'm not even going into the MCH indicators, but they're all there, whether the mother got ANC and whether the infant was delivered in an institution or under professional care. All of that information is available. This is directly on children. We've got breastfeeding, we've got feeding. I mean, the IYCF, the infant and young child feeding indicators that have been agreed to internationally. We've got all of that information, stunting, wasting, underweight. Vitamin A supplementation is becoming more and more in most countries. Iodine testing so you know whether the household salt is iodized or not, the salt that children are eating. And of course, anemia. Thanks. On education, we've got education level attained by each household member, so that comes out from the household, and then of course we calculate attendance ratios, etc., in keeping with the MDGs. And we will be obviously challenged to meet a lot of the metrics information for the new goals when they are set. Next, please. We also have all the background information on household sanitation, water, toilet facility, the kind of fuel used. I mean, a lot of research has focused on children's health, ARI, etc., based on what fuel is being used in the household. There's an increased emphasis on finding out who smokes and whether they smoke inside the household. So all of that information is also available. A lot of surveys have information on smoking. Household socioeconomic status, DHS, along with the World Bank, had pioneered the wealth index, which is now commonly used in a lot of surveys, which is not based on income, it is based on assets and the living conditions of households. And we've got the malaria information on whether children are sleeping under bed nets, and which provides you with exposure to malaria. All right, so when I had asked what exactly what would you like me to present on, because I'm not an expert on early childhood development. DHS does not focus on it from the development point of view. We focus on it from the health point of view. And Gillian said, well, exactly what a lot of people have been talking about today, that she said, she gave me the stuff in the black as the background. And she said, for 30 years, DHS has helped change how we understand what's been happening in the world or how we monitor what's been happening in the world with regard to infant mortality. And in red, she said, as child mortality continues to drop, what can the DHS tell us about more than 200 million children under 5, sorry, I typed it wrong, more than 25 times the number of children who die before their 5th birthday, who survive but fail to reach their development potential. My answer is, I'm going to show you a few slides, messy as hell. However, there's a point to be made. DHS does not directly measure whether children, the outcomes for small children in terms of whether they're learning early enough to read, or that they're able to, their motor skills, or there is no direct measurement of those kinds of indicators. Yes, you heard from, I believe, Claudia Capa yesterday about the mix. Presumably, she spoke about their early childhood development module, which also, where there is not a mix, we very often help UNICEF out by implementing that module. So we do have a lot of countries with all of the data that I've spoken about, and also the early childhood development module that Mix had developed. So we collect that data, and it is part of the data sets that we distribute, but that is not a module that DHS has developed. We harmonize with UNICEF and use their module. So that data, those data are available for, I believe, almost more than 50 surveys at this point in the DHS. However, DHS itself, the core questionnaire, doesn't deal with that. However, it does give you a lot of information on some of the other things. And these are my wonderfully messy graphs that make a certain point. The thing I want you to focus on is this is probably a graph of something like 60 countries, because there's so much overlap in these lines. These are trends. These are the countries in which we have data on the same variable over time, at different points of time, typically about 5 years apart. And this is data on orphanhood. And we have information on single orphan, double orphan, etc. But this is just simply a graph which shows you how many countries are, okay, most of the countries over time, with very little change, lie between, this is a graph of in how many countries are children not living with either parent because the parent is dead. Just that part. And you can see that most of the countries lie in the less than 1%. However, there are several countries that lie above the 1% mark. And in fact, you have, and this is children under 15, you can actually do it for exactly the age range that you might be interested in to see how many children are living without parents. And you find that in places like Zimbabwe, you've had almost 6% of orphans, both parents dead. Lesotho, it's 5%, and it has increased over time. We are going to be in Lesotho again in the next year, and let's see whether this has gone down at all. Okay, next, please. Okay, this, however, is an even more interesting graph, because guess what? This is children living without parents where both parents are alive. And look at that percentage. And we're talking about changing parents' minds, teaching parents. We've got a whole lot of children who are, in fact, not living with parents at all, even though the parents are alive. What about them? What's the message for them? So we've got here 26% in Namibia, where both parents are alive, and these are children under 15, granted, but I looked at it also for children in the age groups of 6 to 9, which we have a stat compiler which allows us to do that, which you can just go to our website and look at. And you will find that the percentages are disturbingly high. Next, please. This is education. Yes, I know that in the post-2015 discussions, I was in some other forum at some point where the fear is that education, most people feel, oh, we achieved the MDG for primary education. And in fact, the emphasis may fall off from education. However, this data, this is a single point. These are not trends. This is the latest survey for each of these countries. And you can see that there are several countries in which, even now, you've got children, less than 33% of children who've completed primary school. There are plenty of countries that have more, but primary school is your basic stepping stone to being productive in society. And even that is not 100% in most countries. Next, please. And this, I think, is my last messy graph. And this is about stunting. And it tells the whole story. These are all trends, and there is virtually no change. And look at the high percentages. The first reaction in most countries when the stunting data or the malnutrition data comes out for a country is denial. It just cannot be that high. And yet, if you see the trends, yes, there is a declining trend, but it is infinitely slow because stunting is long-term. Next, please. Okay, so in other words, DHS already helps to answer questions such as, are children age 0 to 4 appropriately fed? Are children 0 to 4 starting life malnourished, anemic? What is the context in which children of any age live? So the context within which we have to bring that change to happen. Are they living with parents at all? Are they living in poverty? In families with no education? So we got information on whether, whoever is in the household, whether they've got any education at all. In households where they breathe smoke, whether it's from the fuel that's being used for cooking, or whether because people smoke inside the household. All of these have long-term health and developmental consequences for children. Do children go to school in an age-appropriate way? Are they fully immunized? And as I mentioned, if we harmonize in a country with UNICEF, we sometimes have child labor, we have child discipline, and we have early childhood education. Something, by the way, that I did not mention here, but which is very close to my heart, because before I became director, I used to be the senior gender advisor to the project forever, is the fact that we also have information on whether the mother is beaten or not. And we know the intergenerational consequences of violence inside the house. So for a large number of countries, that information is also available as to whether the children have mothers who are beaten. Okay, next, please. Just two very quick slides in case you ever decide that you want to go see what it actually is, and don't take my word for it. You go to the website. We've got data archives that are there from day one of DHS data collection. Downloadable data can be downloaded free, and separate data sets prepared for each country. You can get it in whatever format, whatever you like, SPSS, data, SAS, flat files, whatever it is that you prefer. Next, please. And that's it. That was a whirlwind tour.
Thank you, Sunita. That's a rich, rich, rich resource, which we are fortunate to have. So next up is Paul Gertler from the University of California at Berkeley. And this is just a reminder to those speaking at the podium that the light is not working. You had a time trigger, but you can maybe take a look over here, and I'll let you know when you have 2 minutes left.
Okay.
Okay.